Good afternoon, everybody, and thank you for being here with us today. This is the first weekly press conference to be held to provide community updates and information. I've got a number of bullet points that I'd like to go through today, and then we'll turn it over to the other speakers and answer questions at the end of that. First and foremost, though, I'd like to thank all the municipalities, local law enforcement, fire rescue, county administration for their continued problem solving and consistent messaging so far through this COVID-19 event in the county. We are in touch every day, 7 days a week, with a conference call where all the city managers, the law enforcement chiefs for each one of the municipalities, and the sheriff are all on board at that call, and we discuss events that are going on in the community, how we're going to respond to those events, and make sure we're delivering consistent messaging across the board. Currently, we have 14 confirmed cases in the county and multiple patients that are currently in the testing pipeline. There are 2,900 confirmed cases statewide. The Cleveland Clinic has established a drive-through testing station at the hospital in Vero Beach, but you must first call to set up an appointment and talk to one of their healthcare practitioners. They will schedule a time for you to come in, and they're doing this under the guidelines of the Department of Health and the Centers for Disease Control. We have just released a situational report on all of our social media for the community, and those will be going out Monday, Wednesdays, and Fridays, and that contact information through Cleveland Clinic is on that report. Just to kind of give you an idea of the number of contacts and the number of calls that we're on a daily basis through our office in emergency services. Every morning at 7:45, we have a conference call with all the battalion chiefs, ongoing, offgoing with fire rescue, along with the Division of Forestry. A lot of people are asking us why are you including the Division of Forestry? We're becoming very dry in the west end of the county, and we want to make sure that our response posture for brush fires, if they start popping up, and we've had a few that haven't got too big yet, we'll make sure that our response posture is where it needs to be. We have statewide calls with the Florida Surgeon General and the Department of Health and ACA on a daily basis. Every day we also have a conference call statewide with the Emergency Management Office in Tallahassee and all emergency management coordinators throughout the state of Florida. There's a daily conference call with all county department heads, and we have a daily conference call and meeting with all of our emergency support functions partners that have actually stood up, and there's 4 of those. That would be law enforcement, fire rescue, food and water, and the Department of Health. And we talk daily, every day of the week. Once again, we'll be sending out, we send out daily situation reports to all of our cooperating agencies, so they're aware of what's going on, and each one of them is aware. We also we will be sending out a version of that product on Monday, Wednesdays, and Fridays, usually by mid-afternoon. We've started making adjustments to response posture and protocols for some law enforcement agencies, as well as with fire rescue, when we receive a potential COVID-19 case. Statewide, there's a current shortage of PPE, personal protective equipment, but we have sufficient stocks in-house today to take us for about the next week and a half, 2 weeks. We got an order yesterday, and those are being distributed primarily to the adult living facilities and through the nursing homes throughout the county, because they are at the critical shortage right now. We also sent some out to our first responder agencies, and so they have adequate supply. We are expecting the second shipment of that, and part of that will actually be coming out of the national stockpiles. We expect to have that the first of next week. We are ready to deliver meals and other supplies to those that may be on a home quarantine through the assistance of our Go Line, which is our bus service, and our community emergency response teams. We've been in contact with them, and we can reach out to them almost immediately. A list of local government closures can be seen on the county's website at www.irc.gov. That's www.ircgov.com, as well as each municipality will also be uploading information on their closures for municipal services. If you go to those sites and take a look at them, please go to the county alert system. It's called Alert Indian River. You can actually tap into that. It will give you, when we send out emergency messaging, you will receive that. And it usually will give you a link that will automatically populate and you'll be able to use that. We strongly encourage and continue to encourage, along with the health department and the CDC, to practice the social distancing, continue to do the hand washings and all those other recommendations by the Florida Health Department and CDC. The CDC will be releasing a modeling profile next week. We expect it by the end of next week. And that should give us some idea of when surges may start to occur. They're supposed to be doing it, I think, by state. But give us an idea of when we can anticipate surges, what those numbers may look like, and give us additional planning tool. The Emergency Operations Center continues to have daily contact with all of our neighboring counties and the entire Region 5 emergency management teams. There are absolutely no issues with grocery store supply chain or with the fuel supply at this time. With that, I'd like to turn it over to Miranda Hawker, who is the Director of the Indian River Health Department. Thank you, Miranda.
Thank you, Tad. As Tad had directed, the current number of cases is 14. 6 of these are travel related and 6 are not travel related. 2 of these cases are unknown and under investigation. Our hospitalized case has been released to home, and 9 of our cases are within the city, within Vero Beach. The age range of our cases is from 25 to 84, 5 men and 9 women, and 0 deaths. All of our cases are self-isolating and recovering. The health department has closed its lobby to the public and is providing all services by appointment or over the phone. This is to limit staff and customer interaction during the time of our COVID-19 and to limit spread. We are maintaining essential public health services, but we're changing how these services are delivered. Our main telephone number is 772-794-7400, and departmental information is available on our website at Indian River, all one word, .floridahealth.gov. I want to encourage all Indian River County residents to stay home and only go out for essential trips like work or for essential supplies. Maintain a minimum of a 6-foot distance when interacting with other people. Cover your cough and sneeze with a tissue or your elbow. Avoid crowds and keep any meeting to less than 10 people. Maintain your social distance of 6 feet. Make sure you're washing your hands. Use your hand sanitizer. Do not touch your face. And these actions will make sure we minimize the spread of COVID-19 in our community. And please stay home when you're sick. Monitor yourself for symptoms of fever, cough, and shortness of breath. I do want to go through when the health department receives lab notification of a case of COVID-19. There are things that we are doing. Our epi staff, that means epidemiology, is contacting those individuals and directing them to self-isolate for a period of 14 days. We're also determining close contacts and directing them to self-isolate for 14 days. Each of these 2 groups is also monitoring symptoms twice per day, and public health is monitoring these individuals. Contacts are also asked to self-monitor their symptoms and immediately self-isolate if they become sick. I can't stress enough that everyone should be paying attention to their symptoms and staying home when they're sick. If you have symptoms of COVID-19, call your healthcare provider prior to coming into the office so they can evaluate you. If your healthcare provider determines testing is needing and you meet the screening criteria from the Department of Health, as Tad had mentioned, drive-through testing is available at Cleveland Clinic in Indian River. The health department is also providing testing on a limited basis for prioritized groups of hospitalized patients, long-term care facility residents, healthcare workers, and first responders, as identified through physicians or through the hospital. The State Surgeon General has issued a public health advisory directing that all individuals 65 and over and any individual with high-risk conditions to remain in their residence and take all measures to limit the risk of exposure to COVID-19. High-risk conditions include, but are not limited to, chronic lung disease, moderate to severe asthma, serious heart conditions, immunocompromised status, cancer, severe obesity, diabetes, renal failure, and liver disease. The State Surgeon General also addressed that business owners should look to allow telework of their employees and make every effort to reduce on-site workforce to 50% capacity where possible. So that means looking at flexible work schedules so you have less density within the workplace. So if you have, let's say, 70 employees, you want to try to get to the density of employees within your workplace to 35. By doing that, you're also complying with those measures of social distancing. And that's the strategy behind those directives. The Department of Health has established a local call center at 772-794-7411, and that's active Monday through Friday, 8 to 5. The State Department of Health call center is in place 24/7. That phone number is 1-866-779-6121. You can also email 24/7 at covid-19@flhealth.gov. And the dedicated website is www.flhealth.gov. I can tell you statewide, flu activity has been decreasing, and our current flu activity here locally is mild. I do want to address a few myths about COVID-19. I know everyone has probably gotten an awful lot of questions, and these are some of the myths that we've been hearing that I wanted to address. So the myth is that hair dryers can kill COVID-19. So hot air is not going to prevent you from getting this virus. You could also burn yourself severely by holding a hot air dryer close to the skin. Another myth, as you can see by our case data, with our youngest case being 25 years old, only older people are at risk for COVID-19. Younger adults can also get infected, and that's something that we want people to remember. It's not nearly as often as those people who are older or with compromised immune systems like heart disease, lung disease, diabetes, but young adults in their 20s, 30s, and 40s should still be vigilant that they don't get this virus. And if we have less people getting sick, that means we're protecting our people who are most vulnerable. The next myth, spraying bleach on your body or drinking or gargling bleach, hand sanitizer, rubbing alcohol, or vinegar can prevent COVID-19. None of these recommendations protects you from getting COVID-19, and most of these practices are dangerous, even deadly. The best ways to protect yourself from COVID-19 is to wash your hands with soap and water, practice social distancing, and stay home whenever possible. And at this point, I'd like to introduce Corey Richter, who many of you know is the former deputy fire chief, but he has been hired with the health department to work with ESF8 and also be the liaison to our hospitals and fire rescue.
Thank you. Name's Corey Richter. Just got hired to work with the health department, like Miranda said, to bridge the gap between fire rescue and the hospitals and the health department. So we've been working. I started Monday, and it's been a whirlwind week, getting everybody together. We've been talking every day with all the entities, and the communication between all the hospitals is helping both the hospitals be prepared, fire rescue be prepared, and we're all on the same page as to how to respond to potential COVID-19 patients and how to get them to the hospital safely for not only our personnel, fire rescue, health department, and for the hospital personnel. The hospitals themselves are equipped to handle this and have been preparing for quite a while. They're meeting regularly. Cleveland Clinic, Indian River Hospitals, instituted the incident command system internally, and so is Sebastian Hospital. They're preparing for this to potentially get worse, so they're ready. The hospital has enhanced their COVID-19 testing process and will provide more details at a later date. That's Cleveland Clinic, Indian River Hospital. So hopefully they'll get better testing. Right now, their drive-through testing location, as of yesterday at 5 o'clock, had taken 1,631 calls to their hotline. and 127 appointments scheduled, 128 COVID-19 tests have been performed, and that the phone number to call them to get screened to see whether you can come get tested is 772-226-4846. All right, so of course, like we've all said, and everybody should do, is the best way to prevent it is social distancing, washing your hands regularly, keep your hands away from your face and mouth and eyes when you've touched things that haven't been thoroughly cleaned, and regular hand washing, and having the hand sanitizer, alcohol-based, to be able to clean your hands regularly. And then I'll turn it over to, who are we turning it over to? Back to you, Jason. Back to Jason Brown. Thank you, Jason.
Thank you, Corey. Maintain our social distancing. Hello, everyone. I just want to make everyone aware that you can be assured that our number one priority is the health and safety of all of the residents and visitors of Indian River County. With this in mind, officials from all local governments within Indian River County, as Chief Stone mentioned before, including the City of Vero Beach, City of Sebastian, City of Fellsmere, Town of Orchid, and the Town of Indian River Shores, have been in constant contact with each other, and we're working around the clock to ensure the best possible response to prevent against the spread of COVID-19 in Indian River County and mitigate its effects on our community. I want to remind everyone that the county's Emergency Information Center is currently open and will continue to be open 7 days a week from 8 a.m. to 5 p.m. This is staffed with county employees who are available to answer your questions related to prevention measures, available healthcare facilities, travel guidance, and more. You can reach this line by calling 772-226-4000. As you can see here, the County Emergency Operations Center is also operating under what we call a virtual level 2 activation. Unlike during a hurricane, where the EOC is bustling with about 100 people, we're promoting telephonic participation as much as possible in order to limit the spread, the number of staff congregated in this facility at one time. With respect to county operations, in furtherance of our mission to keep everyone healthy and safe, we've restricted access or completely closed most county facilities, including our county administration building, which is now closed for in-person customer service activities in order to limit public interaction between customers and county staff. Additionally, the county shooting range and Sandridge Golf Course have been closed until further notice, along with the county beach access points and the City of Vero Beach access points. While many county operations have been altered or closed, you can still utilize many county services, such as downloading ebooks from our county libraries or taking advantage of those county services which are offered electronically. For more information on those services, please visit the county website at www.ircgov.com. Additionally, please visit our library Facebook page and County Parks and Recreation Department Facebook page to take advantage of the home-based programming that our creative county staff have put in place. If, like me, you need to work off some extra snacks from staying at home, you can also check out my personal favorite at-home program put on by the Indian River County Library, which is the Healthy at Home Challenge. Check it out when you have a chance. As always, the county will continue updating our website with all new developments related to COVID-19, and you can receive those updates by following us on Facebook and Twitter and signing up for those web alerts at alertindianriver.com. So remember, Indian River County and all our municipalities within the county are here for you and will continue to do all we can to ensure that not only our residents remain healthy and safe, but that everyone is informed with the most up-to-date and accurate information. And I also want to thank our first responders, our fire rescue, our police officers, the healthcare workers, and I ask that you continue to, as Miranda said, stay home if you don't need to go out. Only go out to work in essential trips. If you do that, that will help us keep our first responders and our healthcare workers safe. With that, I will turn it over to the sheriff. Thank you.
Well, thank you, Mr. Brown, and good afternoon for those of you that took the opportunity to join us, and I appreciate the social distancing. Let me assure every resident and visitor that's in Indian River County that you will remain being safe. Our law enforcement officers throughout this county and the municipalities are vigilant about what we do. It's a serious business. As I can tell you, some of the protocol has changed with respect to when and where we respond to certain calls. Obviously, our first responders have the PPE kits and gloves and everything else that you can imagine. Also tell you, on a note close to home, the Indian River County Sheriff's Office, we currently have one deputy sheriff that's self-quarantined that has been tested. And we also have a 911 operator, vital to our agency, and that 911 operator is in self-quarantine awaiting the test results. So I can tell you that we take this very, very serious as first responders. We will be taking specific calls over the telephone and or electronic means to reduce our calls for service as much as we can. As you know, we typically answer about 200,000 calls for service a year in our county. I will tell you that the call volume has decreased a little in the daytime, but I will tell you, friends, that in the evenings things pick up rapidly. I would encourage you to behave yourself, stay inside like the others have mentioned before. Those parents with juveniles that may think it's a good idea to go out and burglarize cars and vandalize things, please, parents, keep an eye on your juvenile kids. We've seen an increase in that for sure, particularly in the South County region. But I can assure you and confirm to you that not only with the deputy sheriffs on the streets, the force multiplier that we have with all of our school resource deputies, some 30 deputies that are now deployed to road patrol. Obviously, school's closed. Our response time is outstanding, but please stay home, behave yourself. We will get through this. There's no doubt about it. We've been through it before. Chief Stone, myself, Administrator Brown, Ms. Hawker, we've got a tremendous amount of experience. I think collectively between just Tad and myself, we've probably got 80 or 85 years. So this is going to pass and we're going to be fine. Remain calm, stay inside the best you can. Respect your first responders who may be asking you questions upon arrival and or on the telephone. Some questions maybe you don't want to answer, but we're going to ask specific questions so we're better prepared upon arrival at your business or residence. So with that, Mr. Brown, we'll take any questions, I guess.
Yes, please, if you got any questions, we're glad to try to answer those for you. Yes, please.
Question for Sheriff Laura. Sergeant, while you're still up here, you mentioned there's a 911 operator and a sheriff deputy that are currently self-quarantining, is that
Correct.
correct? Have they both been tested?
Yes, sir, they have.
Yeah, both. Thank you.
You're welcome.
Sure. Speaking of tests, are there other places giving tests besides Cleveland Clinic?
I would defer to the health department.
And can you say what they are and how many have been given?
So what I can tell you is from the health department's perspective that we currently we're doing testing within the health department. Cleveland Clinic is doing testing. Some limited doctor's offices are doing testing as well, but I don't have a list of those at this point. But if you are interested, if you have symptoms and you want to be tested, I would call your doctor first because your doctor needs to be able to rule out if you have other illnesses that may be causing your symptoms. And then at that point, if you meet screening criteria, then that's from the Department of Health. You can either be tested at Cleveland Clinic, or if you're within those groups that I had mentioned for testing at the Bureau of State Labs, then the health department would conduct that testing.
So how many other tests have been given in Indian River County at this point?
I can get you that number. If you wait one
Okay,
moment, I
sure.
can get that for you.
Okay.
Anything else?
I did have a question for
Yes, sir.
Yolo.
Hello, Nick.
Hey, how's it going? Just to clarify TC Palm's question, so for the deputy sheriff and the 911 operator, they tested positive?
No, they're under quarantine right now
Okay.
at their home. We're patiently awaiting those results.
Okay, so they're both.
We also are doing an investigation on where they had been, let's say previous shifts and the like, as well as their respective platoons and coworkers that we work with. Very cautious. We are consistently having our 911 operations center cleaned, fumigated, whatever you want to call it. Make sure that's vital to this entire operation. Those men and women that work in there, obviously, it's a small area, but that's vital to us, and we're going to do everything we can to make sure that place is clean.
Sheriff, while you're up there,
Yes,
how
sir.
are you enforcing, you know, the rules about folks from the metropolitan area in New York coming in and self-quarantine.
All right, so that was Executive Order, I think 2080. Obviously, the airports are handling a little different than we are. A lot of questions asked, are we stopping cars from New Jersey and New York? That's not the fact. In fact, at the governor's conference, press conference at 2:30 this afternoon, he is suggesting, because of the New Orleans issue, screening traffic on I-10 coming east to our state. I haven't been totally briefed as his conference is just concluding now. But we asked those particular questions, Larry, but we do not and will not randomly stop cars without a state tags. I know that that's a myth that's out there. That doesn't happen on a lot of levels and a lot of reasons. So that is part of our questioning when we come into people about, you know, where have you been or what have you. Also want to mention we're seeing an increase in domestic violence in the evening hours. We're also seeing an increase in some behavioral health issues, which unfortunately I suppose could be imagined at this time. Any more? Yes.
Nothing for Mrs. Hawker, actually, whenever she's available. I don't know.
Brandon?
Yeah.
Mrs. Hawker, do we have a set figure on how many tests either have been ordered or within county lines right now?
So what I can tell you is, at this point, and this is through the Bureau of Public Health Labs, so this is what's ordered through the state. So there have been 159 tests, 14 of those are positive, and so we're awaiting results on 16. The hospital has done 249 tests, and 206 of those are pending. And some of this is the data that I have reported at this time. So that's subject to change. There may be some variation of that data through the reports that are on the website each day, and it'll be refined as we move forward. But that's from the current report.
But as far as testing capacity goes, how many tests are potentially available if there was a need or an increase in tests?
So what I can tell you is from the health department's perspective, I have 183 tests currently, that testing kits. The hospital, I don't have that information readily.
Public
but you can
testing
ask for
kits.
them.
183.
But at this point, what I would like to stress is we do not have a shortage of testing kits.
And we being the Department of Health.
We being Indian River County.
What about the, you talked about a number of pending tests. Can you talk about the delay in test results coming back?
So what I can tell you from commercial labs, that current timeline is about between 3 to 7 days from what I understand. The Bureau of Public Health Labs, which is the state's public health lab, that timeline is between 24 and 72 hours. And so those tests that are being sent to the public health lab are prioritized based on those groups that I had mentioned. So people who are in nursing homes or long-term care facilities, people who are first responders or healthcare workers, people who are hospitalized. Those tests are going to the Bureau of Public Health Labs. That's a more limited resource, but certainly any doctor is able to send a test to a commercial lab. Does that answer your question?
I think so.
Okay.
Do you have any estimate as to where we are in this process in terms of, you know, the timeline or the curve, that sort of thing?
So as Chief Stone had mentioned, we're expecting the CDC to release some new modeling data next week. I can tell you that we are still, with all of the testing that's occurring, we'll get a more accurate picture of what's going on in our county. But I think what I want people to remember is that the actions that they take by staying home when they're sick, the actions they take by staying home except for essential trips, all of those things are going to help limit the spread within our community. People washing their hands, being cognizant that you're not touching your eyes, nose, or mouth, all of those actions are going to keep us healthier. And so that is going to impact the number of cases that we see locally.
So people, in other words, are you saying that people should be patient with this whole thing? That it could last longer, and the more we do, that will help sort of flatten the curve, I suppose.
That's exactly the phrase, you've seen the phrase that's out there, that's absolutely right. We want to keep our curve from going sharply up and down. We want to make that a more gradual rise, so it's less strain on our healthcare system, and we're better able to cope with the resources that we have. So as to an exact time, I do not have an exact estimate of time, although I do expect that we're going to be dealing with this for several months, and then we also, until there's a vaccine, because that's at the point that's about a year away for a vaccine. I haven't seen recent estimates and recent information on that, but we are going to be coping with COVID-19 for a while.
You talked about there being several cases in Vero Beach in particular. I assume that includes some of the unincorporated county, well, obviously Vero Beach there. But what about in the North County? Is there any, Fellsmere, Sebastian, are you seeing any positive tests up there?
So right now, the state is reporting municipalities. So we have 9 cases within the city of Vero Beach. And so the remainder of our 14 cases are not part of a municipality because they're releasing the municipality information.
Okay. And just to confirm, when you said, did you say earlier that the one hospitalization had been released?
Yes.
Okay. So right now there shouldn't be any, to the best of your knowledge, the latest you heard, there weren't any hospitalizations?
Currently, we don't have any COVID-19 cases hospitalized, and they're self-isolating and recovering at home.
So to clarify on a point you just made about municipalities, so does that mean, say there were a positive case, hypothetically, in, Fellsmere or somewhere, out there, is there no, data from the Department of Health that you're reporting on those cases, or is that data just not listed as a certain, region of the county? How does that work exactly?
If we had cases within those municipalities, they'd be reported on that dashboard report for the Department of Health.
Under the municipality, right?
Yes, but what I do want people to remember, and I don't want people to feel safe just because they don't live in the city of Vero Beach, this is a virus that is transmitted from person to person. This is a virus that is transmitted by respiratory droplets. Everyone needs to be vigilant about washing their hands, staying home when they're sick, covering their cough and sneeze. We need to be, all of us have to work together to keep our community healthy.
All right, I'd like to thank everybody for coming in. We're going to do this again next week, next Friday, same time, same place. So we'll be glad to have you come back and visit with us at that time. Thank you all very much.